Namaste, Vanakkam, and happy 74th Indian Independence Day. Good morning to our viewers in America and good evening to those in India. Welcome to the next installment of the International Foundation for People's Welfare and Development series of online debates, where we pick young and inspiring speakers to discuss their viewpoints on the world's most pressing issues. My name is Tejesh Manda, a 12th grader from Monroe Township, New Jersey, and along with me, I have Darshan Selvakumar, who is also from Monroe Township, New Jersey, in the US. Moderating with us today, we have Fahima and Jay Surya from halfway across the globe. Welcome everyone to the first official IFPWD debate based in the United States.
Welcome, this is Fahima. I'll be your India moderator for today, and I'll be accompanied with Jay Surya. Thank you.
Hi everyone, my name is Darshan Selvakumar, and once again, thank you all for joining. Before we begin this heated debate, IFPWD would like to give a warm welcome to our special guest of honor today, Dr. Kannan Thanikachalam. He completed his MBBS at Government Stanley Medical College and his internal medicine residency training at University of Alabama. He also completed hematology and medical oncology training at Wayne State University and is currently working as a hematologist medical oncologist at Infirmary Health Hospital in Mobile, Alabama. Welcome, sir. Thank you so much for taking the time to be here. Would you like to share a few words about yourself to our viewers?
All right. Good morning, everyone. I know it's so early in the morning and probably evening in India, but thanks for inviting me. Universal health care, it's really a much debated topic, both politically and economically, and also to address all the healthcare disparities. So I'm excited to be here and I'm looking forward to the healthy discussion.
Thank you. And again, thank you for being here. Without further ado, let's get right into the topic of the event. Today, we have a one-round online student debate regarding one of the world's most controversial topics. Should universal healthcare be implemented? In other words, should all people have access to essential health services such as treatment, rehabilitation, and emergency care without the risks of financial deprivation? Universal healthcare is defined as a healthcare system in which all residents of a particular country or region are assured access to healthcare. Sure, it may sound like a fantasy, but it is indeed possible with efficient and appropriate economic planning. Just look at countries such as Singapore, Japan, Canada, and Germany, where they are already implementing this ideology. There are definitely two sides to this question, and today we will find out valid points used on both sides of this issue. We don't want to get too much into it to spoil the suspense. With that being said, Darshan, can you please explain the rules to our viewers?
Sure, Tejesh. We have 6 debaters here today, and we have split them into 2 teams of 3 debaters. One team is affirmative, meaning that they are supporting universal healthcare, and the other team is negative, meaning that they're against universal healthcare. The speaking order is as follows: first affirmative, first negative, second affirmative, second negative, third affirmative, and third negative. Each speaker will be allowed 3 minutes of speaking for their opening statement, and they will have one ring at 2 minutes and 30 seconds. Sorry, one ring at 2 minutes, and the second ring at the end. After all 6 speakers are done, we will begin the rebuttal session. In this session, the speakers will be allowed 1 minute and 30 seconds to counter the speeches of the opposing team, and they will have one bell at the end of the 1 minute and 30 seconds to notify them that their time is complete. The judges will then vote on one speaker, 1 or 2 speakers, depending on how we're going to do this, and we will pick who had the stronger argument based on facts, persuasion, and ability to come up with a counter argument / rebuttal. And we will declare them the winner, and they will be receiving a cash prize after this debate. And the decision of this winner will also occur following the debate.
Thank you. It is now time to introduce our 6 brilliant candidates. Starting with the affirmative side, we have Mr. Tanush Swaminathan, Mr. Love Tucker, and Mr. Rishi Suresh, who will argue in favor of the implementation of universal healthcare. Next up, we also have, in the negative side, we have Kaushik Veju, Arav Modi, and Akaprana Ramesh, who will argue against universal healthcare. Without further ado, it is time to commence our debate, starting with our first affirmative speaker, Tanush Swaminathan, a 12th grader in Monroe Township High School, and someone who is aspiring to become a research physician specializing in oncology. His hobbies include music and rapping. Tanush, take it away.
Great. Can you let me know when my time starts?
Yes. Once you start speaking, Your time
Okay.
will start.
Okay. All right. I'd like to start off with some statistics. America, as of the 2018 fiscal year, spent $3.3 trillion in healthcare expenditures, which equated to approximately 18% of our GDP, which also equates to around $10,348 per person. And the sad thing is that our outcomes rank last against comparable nations with similar economic situations as ours, even though we spend almost twice as much as them. We have the highest mortality rates amenable to healthcare, the highest error rates, longest wait times with the exception of Canada, and currently have 28 million uninsured Americans with another 87 million underinsured Americans, meaning that 10% or more of their annual income goes to out-of-pocket healthcare expenses. With no results to back up our outrageous spending, where exactly is our money going? So the current healthcare state of America revolves around a multi-payer system, resulting in affiliations between hospitals and private healthcare companies. Both are for-profit corporations. Hospitals decide the prices of operations, and the privatized healthcare insurance companies decide how much they want to reimburse. However, this skyrockets costs for procedures as hospitals and insurers aim to make large profit margins. The cost of pharmaceutical drugs and procedures also vary widely between American regions because hospitals and big pharma negotiate rates between individualized providers, whether that be private insurers, hospitals, or even individuals. Pharmaceuticals also skyrocket, like I just mentioned, with the average American spending around $858 on prescription drugs, which is twice as much as Australian citizens and 4 times as much as citizens in the Netherlands, according to the American Medical Association. America is late to the ballgame. We are one of the last developed nations to implement some form of universal healthcare, which seems to be working efficiently in other European countries. Like Tejesh mentioned before, for example, take Germany. They spend around $5,000. They spend around $6,000 per citizen and cover 100% of their population. Switzerland spends around $6,000 per citizen. Canadians spend 55% of what we do and have a longer life expectancy and a lower infant mortality rate, according to the 2018 Commonwealth Fund. Such countries also have lower drug and procedural costs, as the negotiating power for
One more minute left.
and drugs is held by a single entity. The government, through universal healthcare, America would save approximately $300 billion on drugs. And while they do fund the system through a raise in general taxes, many reallocate funds from wasted administrative costs, whether that be cutting down on discretionary spending, cutting down on the police force or military budgets, as well as government revenue. Additionally, the Congressional Budget Office, also known as the CBO, estimates that the healthcare deficit will decline by $143 billion over the first 10 years under universal healthcare. Over the 10-year period beginning in 2020, universal healthcare will result in a cumulative deficit reduction of about $1.5 trillion. While government federal spending might increase, the total net health expenditure will decrease. Not to mention, universal healthcare will also simplify hospital payments by funding them through global budgets, saving around $504 billion in administrative costs. Overall, our healthcare system drastically needs reform, and I firmly believe that the implementation of universal healthcare can do exactly that.
Time's up.
Thank you.
Tanus, that was an excellent opening statement. I wanted to share key points that he said. He was saying, he was talking a lot of statistics and facts about money and how we can save it, how he was comparing it with other countries as well. He was basically saying how we were actually we need reform because these other countries here are actually doing it, and they're doing it well. Universal healthcare, and yeah, I just loved all your points. Thank you.
Okay, thank you for that, Tejesh. We will now move on to our first negative speaker. We have here Mr. Arav Modi. Arav Modi is a 12th grader in Monroe Township, New Jersey, and he is basically the highest ranked tennis player and the captain of our school's tennis team. And he is interested in pursuing a career in business management. So Arav, when you're ready, you can begin speaking.
Thank you, Darshan. So we all know there's various reasons why we should pursue universal healthcare and why there's various reasons we shouldn't. And I think there's more reasons that we shouldn't. The first one is a right to healthcare could drastically increase the U.S. debt and deficit. Spending on Medicare, Medicaid, and children's health insurance program, all government programs that provide a right to healthcare for certain segments of the population, total less than 10% of the federal budget in 1985. But by 2012, these programs took up 21% of the federal budget and are predicted to reach 30% of federal spending by 2028. Research from George Mason University concludes that providing government-funded health to all could increase federal spending by $32.6 trillion over the first 10 years of implementation. That's the kind of money we don't have right now. There's another reason too. Providing a right to healthcare could raise taxes. In European countries with the universal right to healthcare, the cost of coverage is paid through higher taxes. In the United Kingdom and other European countries, payroll taxes average 37%, much higher than the 15.3% payroll taxes paid by the average US worker. According to Paul R. Gregory, a research fellow at the Hoover Institution, financing a universal right to healthcare in the United States would cause payroll taxes to double. And I'm sure, Tanush, you wouldn't want your dad to be paying those taxes, even though you might not know that right now. A third reason, doctors would have less flexibility in negotiating rates. In addition to lowered costs, the other downside to government oversight is that doctors have less flexibility in rate negotiation, which is highly detrimental, which decreases their profit drastically. With a single-payer healthcare system, government bodies determine the actual amount doctors can charge for services, which is
One more minute left.
which is a stark contrast to the current system where medical practitioners set their own fee schedules and then negotiate rates for specific services with insurance companies. Those are just some of the main points, but some of the details we can also overlook are healthy people would be paying for others' medical care. Chronic diseases make up 90% of healthcare costs. The sickest 5% of the population create 50% of the total healthcare costs, while the healthiest 50% only create 3% of the costs. We also would find out that people would have less financial incentive to stay healthy. Without a copay, people might overuse emergency rooms and doctors. And one last reason is doctors may cut care to lower costs if they aren't well paid by cost-cutting government. For example, doctors report Medicare payment cuts will force them to close many in-house blood testing labs. That's all. Thank you.
Thank you, Aura, for that wonderful speech. I actually liked a lot of the points that you brought up, and some of the points he actually brought up were how in the US, the debt is projected to increase by $32.6 trillion if the system is implemented into our society. And as a result, we would have our taxes increasing and the rates for medical services would definitely change. And in essence, he said that healthy people would be paying for unhealthy people, and also standard of care might decrease. And all of these are valid points to bring up in an argument against universal healthcare.
Thank you for that, Darshan. Now we will be introducing our second affirmative speaker, Love Tucker. Love is attending a prestigious 7-year medical program at Nova Southeastern University in Florida, in which he will receive his doctorate of osteopathic medicine degree. In addition to medicine, he enjoys watching and playing basketball. Love, take it away.
Thank you, Tanush, for the warm welcome. The Declaration of Independence states that all men have unalienable rights that include life, liberty, and the pursuit of happiness. The preamble of the United States states that one of the aims of the country is to promote the general welfare of our people. So how are we providing them with the right to life, liberty, and the pursuit of happiness? How are we promoting the general welfare of our people if we don't even provide them with the basic need of healthcare? Today in the United States, there are 28 million uninsured people. That means if something were to medically happen to them, there's no guarantee that they would be treated. Even the United Nations has declared healthcare as an essential right and essential to sustainable development. And accordingly, almost every developed country except the United States has adopted some form of universal healthcare. And this is part of the reason why medications outside of the United States cost almost 10 times less than within the United States. If we look at a very common blood thinner, Coumadin, taken by millions of Americans every single day in the United States. In the United States, it costs $12 for every 5 milligrams. Right over the border in Canada, it costs 47 cents for every 5 milligrams. So this huge disparity in cost of medications ends up hurting the consumers of healthcare that are paying for it. It doesn't hurt the government. It doesn't hurt the manufacturers or pharmaceutical companies. It hurts the consumers, normal people like us that are paying out of our pockets heavily, or our insurance companies that are also paying heavily for these outrageous prices within the United States. And a common scenario we see in the United States is that an uninsured person, let's just say we have an uninsured person, he begins to have a medical problem. Because he cannot afford to visit a doctor's office, which costs between $100 to $400, which may be unaffordable for a lot of people, he would put that medical problem off until it results in a visit to the ER. And by EMTALA laws in the United States, an ER cannot refuse care based on lack of ability to pay. So when that uninsured person goes to the ER, who eats the cost? It's the government that eats the cost, that huge ER medical bill, because obviously, since they didn't have insurance in the first place, they cannot pay for the ER bill.
1 minute left.
In the end, that ends up costing, the government and also taxpayers and ourselves more. And I like how the previous negative speaker brought up that healthcare would actually end up costing more. Well, like Tanush said, if we switch to a single-payer healthcare universal system, it would actually cost us a smaller portion of our GDP, because if we switch to a single-payer healthcare system, there's only one agency that's being billed. It would cut down on administrative costs. Basically, right now we're billing multiple insurance agencies. We're going through multiple agencies, and if we cut out that administrative cost, that middleman, we'll save less money. We'll save more money overall. End up paying less on insurance, which means less money out of taxpayers' pockets, and overall a small portion of our GDP. So, like the judge said, it's not a question of if healthcare, universal healthcare can be implemented. It's a question of should it be implemented, and looking at other country examples and looking at how our country is handling healthcare.
Your time's up.
It should be implemented.
Love, thank you for that. You brought up a lot of valid points. I like how you started off with the Declaration of Independence. That was a unique way of starting your statement. I also like how you used examples and a specific statistics from our country. 20 million people are uninsured, and how all the other developed countries have some form of universal healthcare except us. And I also like how you compared the cost of pharmaceutical drugs. That really emphasized your point even more. Overall, it was an excellent argument. Thank you.
Okay, thank you, Tajesh. We will now move on to our second negative speaker, Agriparna. Agriparna is an 11th grader at Woodbridge Academy in New Jersey, and she's currently studying in order to pursue a future career in medicine. Agriparna, you can start when you're ready.
Good morning and good evening to all. During the current circumstances, the topic of healthcare coverage is continuously debated. Termed by the World Health Organization, universal healthcare coverage means that all people of all societal measures will have access to healthcare services when they need, including prevention, promotion, treatment, rehabilitation, and palliative care, without the risk of financial hardship. Financial hardship, however, should not be prioritized over quality and effective care. To understand the effective outreach of medical services, healthcare economics first must be understood. This pathway regarding supply and demand is unlike other industries. Whether supply is high or low, healthcare demand continuously remains extensive. As patients lose the value of medical services through universal coverage, lose the value of these coverages, the demand will potentially increase, making it impossible to provide care during situational emergencies. To accommodate such demand, more doctors must be available to support these patients. However, Canada, the United Kingdom, and other European countries following the universal healthcare coverage experience a doctor shortage of at least 275,000, while Asia, particularly India, has 600,000 doctors and nurses without proper government-funded equipment, therefore rationalizing its supplies in possible detrimental scenarios. These numbers are predicted to grow only further due to COVID-19. Doctors also cannot negotiate prices with the government agencies, so they must make do with whatever the government provides, significantly increasing patient out-of-pocket costs compared otherwise. National budget costs will also notably expand. The Canadian government alone uses 40% of the national budget, $264 billion annually to provide their healthcare services. However, several conducted research signifies that such amounts do not increase healthcare quality relatively to the same stance.
1 minute left.
Implementing universal research reduces the government's budget for rare disease research opportunities, which negatively affects 25 million Americans and 400 million individuals worldwide, not under particular universal healthcare reform. Without the burden of national universal healthcare coverage costs, industrialized countries can lead in research and specialized disease care. In the United States, 5-year survival rate for all cancers is 67%, compared to 60 in Canada and 54 in the United Kingdom. If such quality is restricted to provide proficient care, then universal healthcare coverage should not be implemented. So thank you.
Thank you, Pranav, for that amazing speech. Some of the key points that she brought up include how that we should essentially prioritize medical care and services over financial hardship. And through a universal healthcare system, the demand for medical care will increase, and that will result in a shortage of doctors. And as a result, so many people would not be receiving the same level of care that they would if there wasn't a universal healthcare system. And also, for this to be implemented, national budget and out-of-pocket costs will definitely increase. And instead of implementing a universal healthcare system, she said that we could use that same budget and use it in medical research to find out different cures for diseases and stuff like that. And overall, that was a really good speech. Thank you, Pranav.
Thank you, Darshan. Now introducing our third affirmative speaker, Rishi Suresh. He is a 12th grader who goes to high school in Virginia, and he is interested in scientific research and aims to pursue a career in medicine. Rishi, take it away.
Hi, I can just start?
Yep.
I affirm the benefits of universal healthcare, henceforth referred to as UHC, far outweigh the harms. I will be arguing using statistics based on the American population, due to the fact that some countries already employ a UHC system and some countries don't even have a healthcare system. It's simpler to explain the benefits of such a system by applying it to a country that already has a general healthcare system but not a universal system. I'd like to start off by defining UHC. According to the World Health Organization, UHC coverage embodies 3 key characteristics. It guarantees equity and access to health services. It guarantees quality healthcare that improves health. And it guarantees that usage of said healthcare does not put financial risk. With that covered, I'll be covering my point. Section 1, saving lives. Simply put, an implementation of UHC will result in all varieties of people getting quality healthcare for an affordable price. As of 2020, there are nearly 28 million Americans without any form of healthcare. According to Health Insurance and Mortality in U.S. Adults, a Harvard study, a lack of health insurance is associated with as many as 45,000 deaths per year. Furthermore, according to health insurance coverage and mortality among the elderly, more than 1,300 deaths occur each year, just in the 55 to 64-year-old age group, due to lack of health insurance coverage. It's clear that a lack of health insurance is a significant cause of death in the United States. To emphasize this point, the previous statistics only consider Americans with no health coverage. There are plenty with subpar or poor health care, which in some cases can be worse than no health care. A lack of equity in healthcare or a lack of healthcare altogether is a clear cause of death. An implementation of UHC will inevitably result in a reduction of lives lost due to a lack of healthcare. One can look to other countries, for example, on how UHC benefits the general population. I'll use Germany and Switzerland, 2 countries with very different types of UHC. Mortality rates and effectiveness of healthcare can be compared using infant mortality rates and the rates at which people can see specialists. In Switzerland, residents pay premiums of up to 8% of their income, with the government covering everything else. They have an infant mortality rate of 3.7%, and 27.3% of patients reported having to wait more than 4 weeks to see a specialist. In Germany, all residents must have public health insurance. If they meet a certain income threshold, they can acquire private insurance. Germany has one of the lowest infant mortality rates around the world, with 3.1%, and 28.1% of patients reported having to wait more than 4 weeks to see a specialist. In addition to that, German residents have the luxury of getting same or next day appointments, unlike the United States. Compared to these countries, America is plagued with an infant mortality rate near 5.6%, well over other developed countries, while still having 28% of patients reporting having to wait more than 4 weeks to see a specialist, despite the United States using more private than public insurance. In summary, a lack of health insurance is a clear cause of death in the United States, and UHC has shown to be a solution, leading to less mortality in countries where it has been implemented. Thank you.
Thank you very much for that, Rishi. You brought up a lot of amazing, valid points as well. He talked about, first, I like how he broke it down into 3 separate structures. That was really neat. and he basically said how the unprivileged have a lack of health insurance, and basically that would lead to more mortality rate for US. He compared it with Germany, who has a lower infant mortality rate, and that was really good as well. So yeah, a reduction of lives lost. That's basically what he wanted to point out. Thank you so much, Richard.
Okay, thank you to Josh. We will now move on to our third negative speaker. And we have Kaushik Veju, who is a 12th grader in Monroe Township, New Jersey, who is interested in pursuing computer science in the future. He is also on the varsity track team and enjoys running as a hobby. Kaushik, you can begin when you're ready.
Thank you, Darshan. So before I begin, I just wanted to say that everyone who has spoken thus far has done an excellent job in saying their arguments, and I'm really enjoying this debate. So that being said, let's move on to the real matter at hand. So when we think of healthcare in general, right, we think about providing patients with proper medical services. It's not just a matter of giving patients treatments, it's a matter of giving them quality treatments in a timely manner. And this is exactly where the system of universal healthcare is severely lacking it. You see, one of the reasons why universal healthcare is somewhat ineffective is because of the fact that it's socialistic. The government is the one providing health services. And with a socialistic approach to the healthcare, there's a lack of medically enhanced innovations. Let me talk about the United States, which has a capitalistic approach to healthcare. In the United States, healthcare is not provided by the government. Well, unless we're talking about Medicaid, but healthcare itself is a competition in the United States. Various companies in the health industry are competing to provide top products in healthcare industry. And these products are what allow the United States to be, a pioneer in the field of medicine. These products are what allow the United States to be the country that is, one of the most recognized for having the best doctors. So with the capitalistic approach to, medicine, we're creating more enhanced products. And that's exactly what patients need. But with the socialistic approach, such medically enhanced innovations won't come across. On top of that, a point that I would like to bring up, it was stated by Eka Prana, is about quality and quantity. With universal healthcare, it's supporting everyone within the nation, right? So there's bound to be longer wait times in hospitals. And when there's longer wait times in hospitals, how exactly are we going to treat the patients properly? The doctors, their priority shifts from how they can treat the patients to how many patients they can treat. So because the doctors have their own schedules and limited time, how can we guarantee that the patients are giving the best quality service? That's something we have to care for. On top of that, one thing about universal healthcare is that there's a budget cap. See, with any government service, there's a budget for any service, right? And when that budget cap is met, you can't provide any more patients with proper medical care. So there's only a certain amount of patients you can treat until that budget cap has been met. So once that budget cap has been met, you can't treat any more patients. So we need to take care of that as well. On top of that, the one major issue of universal healthcare is the finance. And as Olive mentioned, it's definitely going to raise taxes. And with nations with very low GDPs, nations that are simply developing, how can we expect that these nations are going to implement such a system? They're only going to be drawn more in debt. So we have to look at that as well. And on top of that, healthcare makes up a lot of the budget of some countries. As a matter of fact, in Canada, 40% of provinces use their budget towards medical services. And some of that budget can be used for other services, including education. So there's two major issues with universal healthcare, and that is the financial aspect of it and the quality. And this is one of the reasons why, if we were to implement it in the United States, it would not work for our country. And that concludes my argument.
Thank you, Kaushik. That was very well said. I really enjoyed your speech. And to discuss some of the points that he brought up, he really said that when you implement universal healthcare, quality treatment in a timely manner is usually not achievable because of just the way the system is implemented. And he also said that this is more of a socialistic approach to healthcare. And as a result, this decreases innovation and research because the government is trying to spend all of its money on healthcare, and they're not really putting in the money towards research. And he also mentioned that a more capitalistic approach creates more enhanced services and creates more medical innovation. And he also said that in universal healthcare, quantity over quality is prioritized, but in reality, we really want our quality to be good when we are implementing a system of healthcare. So thank you, Kaushik, for that speech.
Thank you, Darshan.
All right, thank you, Darshan. Before we begin our rebuttal session, Dr. Kannan, would you like to ask any questions for our speakers so that they can answer in the rebuttal session?
No, I think everyone has raised valid questions. I would like to see how the rebuttal goes, and then I can give my final comments.
Okay, thank you. All right,
Yep.
so we will now begin our rebuttal session in which each speaker will have 1 minute and 30 seconds to counter the arguments for the opposing side. We'll begin with our first affirmative speaker, Tanu Swaminathan. Tanush, whenever you're ready.
Okay. All right. Great. All right. Okay. I'm just going to tackle this in sort of like person by person manner. So beginning with Arav. Arav mentioned how raising taxes is the only way to fund universal healthcare. This is false. Currently, our discretionary spending, around 54% of it goes to the military budget, which is around.
I didn't say raising taxes was the only way. I said that they would be raised.
No, right. But yeah, you're just wasting my time now. But yeah, discretionary spending, around 54% of it goes to the military budget. We spend around $1 trillion on our military, which is around the military budgets of the next 10 countries combined. That's a lot of money. If we cut down, reallocate funds from the discretionary budget, as well as the police force, maybe raise taxes for the top 1%, because currently the top 1% pays around 50% in taxes, while in European countries, the top 1% pay around close to 70% in taxes. If we raise those taxes, we could fund universal healthcare. And your fact about healthcare increasing deficit, that's false. Although federal spending might increase, we save a lot more money than we would under a multi-payer system. Moving on to the next speaker. She mentioned how quality should be compromised. And that point would make sense, except quality isn't compromised. Canada has a lower infant mortality rate. They have a longer life expectancy. Germany and Switzerland and other Nordic countries have a higher standard of living on a measurable scale, and they all have universal health care. So you tell me how quality is being compromised. She also said that it stunts innovation and research, except some of the largest biotech companies currently reside in Germany and Switzerland. Novartis, Merck.
Your time's up.
Okay, sorry.
Thank you, Tanush. Well, now, thank you for your rebuttaling. I like how you countered each person's argument in a nice manner. I was actually cutting off, so I couldn't hear a decent amount of it. But what I did hear is that how you countered Arav's raising tax situation. I like how you made a counter argument to that, and basically you countered the main point of each speaker. So that was really good. Thank you.
Okay, thank you, Tajesh. We will now move on to Arav for his rebuttal. And Arav, you can begin when you're ready.
So to counter what Tanush just said, sure, we can cut funding for the military or whatever else you want, but that's just going to require more policies, and it's going to make it more, we're trying to center it on universal health care. We're not trying to worry about other things right now. And after you said that, the fact that I said taxes after you said that taxes wouldn't increase, and you said everything I said was false, you provided no statistics to back it up.
I mentioned discretionary spending budgets.
But I clearly mentioned the countries in Europe in which their taxes are significantly higher than ours, right?
Right, because they have no other way to pay for it. But America, with its leading GDP, has many ways to pay for it. One being through the military budget.
Okay, yeah, but taking money out of the military budget is a whole new policy. What if that doesn't pass? What would you do then? You can't bank on that.
This is from a theoretical standpoint. You don't know if any of this is going to pass, but we're having a debate on what's best, and I think that's best.
Well, it probably wouldn't work. And people should be paying for their own health care. They don't necessarily need to have it given to them by the government.
Okay,
it's not
2.8 million veterans.
It's not an inalienable right. It's not an inalienable right. Nowhere in the Declaration of Independence does it say there is a right to health care. The purpose of the Constitution is to promote the general welfare, not provide it. So.
Okay, and how do we promote general welfare of people? Like Love said, we institute universal health care. And that can be seen through statistics in various other countries that have universal health care, where the welfare of people is way higher than.
And I just stated in those countries, the situations are not as, not everything is as it seems though.
But what? That makes no sense. I literally told you statistics.
I just told you we'd be paying so much more taxes. Do you see?
But I just told you we can cut down on taxes through reallocating funds. Literally, single payer doesn't cut down on doctor salaries. Rather, we cut down on wasted administrative costs. A lot of money is wasted through the discretionary spending. The $300 billion that goes to the military doesn't even fund salaries or overseas missions. We don't know where that money goes.
Yeah, but we don't know that that policy will change. We can't bank on that.
This argument makes no sense because you don't know if anything will ever pass, but we're just trying to see what is best.
Yeah, but the solutions you are providing, they can't stand valid.
That doesn't make sense because all other countries use a solution.
Yeah, it does make sense because I just provide you with facts, and then you're coming up with theories that could undermine them.
Great, Aro. Thank you. Good debate.
Okay, that was very, very interesting to listen to. I enjoyed both of your points, Tanush and Arav. That was very interesting. All right, before I get into that, I just want to say that we're probably going to extend the time for the rebuttals, and you're now allowed to interrupt the other person, and you can go back and forth. As before, we didn't have that rule, but after seeing this counter argument that Tanush provided, we are going to implement that from now on. And
I think that time increased to 2 minutes 30 seconds, right?
Yeah, it increased. Well, it depends on how much the interruption is, but we'll just see from there. And yeah, that was very interesting. I enjoyed both of your points, and yeah, we'll just move on to the next rebuttal speaker.
Yep. So next we have Love, our second affirmative speaker. So go ahead, Love.
Yeah. So a lot of the points on the negative side brought up that universal healthcare in the United States would cause an increase in the need for healthcare services, which would end up costing us more and also resulting in a less efficient healthcare system. To counter that, I'd like to bring up the current times under the COVID-19 pandemic, in which almost every country has seen an increased need for healthcare resources. Now, out of all of the developed countries that have faced this pandemic, the United States has fared the worst. Countries like France, Germany, Switzerland, New Zealand, they fared much better in terms of coronavirus cases and deaths under a single-payer healthcare, universal healthcare system. That means under a time of increased need for healthcare services, a universal healthcare system is faring better than our capitalistic healthcare system that we're under right now. I think one of the speakers, Kaushik, brought up that our universal single-payer healthcare system is socialistic. And the thing is, there's nothing wrong with that because a socialistic healthcare system aims to provide the greatest level of care to the most amount of people. We should not be prioritizing the level of our innovation. We should be prioritizing human lives, which are being lost if we do not provide healthcare to all of our citizens. We cannot disregard 28 million uninsured Americans for light of medical innovation. It's not equal. We would value life over innovation. And as a result, we have our current healthcare system, which is, because of how America is, inherently capitalistic, which insurance companies, hospitals, and even private doctors are chasing profits over lives being saved. And because of that, I would favor universal healthcare over, social, like whatever we have right now, capitalistic system.
Do you mind if I kind of argue your statement right there? Oh, okay. So when you mean about capitalist markets, that is true. As our American government is actually based on a capitalist market system. But when you're looking at that, don't you just want to go against capitalist market and not the whole idea of healthcare coverage for everyone, because that is a whole different topic. Yes, there are some implementations that connect with capitalism and the free market system, but attacking that first and fixing that is more important than giving healthcare to everyone. So that's the main problem here. I understand that you're talking about that, but even when it comes to preventative care and going towards what Tanush said earlier about the infant mortality rates, the reason why US actually has one of the highest infant mortality rates for a developed country is due to the lack of preventative care. But this is not a factor. This is not a factor due to healthcare coverage. If you actually see the highest wait times when it comes to universal healthcare is that Canada has 60 days where a patient it's a 60-day wait time for a patient when it comes to seeing a specialist versus 24 days in the United States. This research was done in 2019, and also further continues by saying the United States, only 25% of patients had to wait at least 4 weeks to see a specialist, compared to the 59% in Canada, 56% in Norway, and 43% in the United Kingdom. If this is the case for preventative care just in the United States, then other countries are doing far worse. But we still have that situation to look forward to. So it's actually, we should not just, right now, we cannot look at healthcare costs before we just look at capitalist markets. Because when it looks at drug prices themselves are.
You want to prioritize the most amount of lives that possible, right? And while Canada may have a higher wait time, what most countries do is they implement a system of triage that whoever has the most severe condition will be treated first. So I don't think the goal should be fixing, is it capitalism versus socialism? I think let's save the most amount of lives possible, and then let's worry about capitalism, socialism, economic policies, or things.
This is trying to figure out what it works in our government. So our government is not most. Sorry.
Right. But except capitalism has everything to do with our current healthcare system. It's similar to buying a burger. You pay for the burger, you get a burger. You pay for service, you get the service. It's capitalistic. But in that fact, you're leaving out people that are homeless, unemployed, or can't afford it, and therefore don't receive the service because they can't pay for it. Now, to get to your point about longer wait times, it is true that Canada has longer wait times, but do they not have better outcomes than America, healthcare-wise? I'm asking you that question.
That depends. Are you talking about general healthcare, but also looking at the future as well? Because when you're looking at future healthcare, we also see great.
Right. No. I'm talking about currently. So currently, their population is healthier. They have a longer life expectancy, like I mentioned before, and that sort of reflects the current healthcare state of Canada currently. Whereas in America, we suffer from various problems, whether that be obesity. Our life expectancy is lower than that of Canada's. So now you tell me, would you rather wait a bit longer and actually get proper healthcare service, or get your service right now and not be proper? That's honestly the question that I'm proposing to you. And also, not to mention Nordic countries, whether we're talking about Denmark, Sweden, if we're talking about Switzerland or Germany, they actually have shorter wait times than America. America ranks towards the bottom in wait times, only beating Canada. Whereas all other countries.
That's actually not true. They actually do beat Norway and the United Kingdom by 56% and 43% respectively.
No. But you're judging that off of the number of people that can book an appointment in a certain number of days.
What's your argument towards that?
Right. Well,
what was your point?
No. I'm just saying that Denmark, UK. I totally forgot to mention the UK. Denmark, UK, Sweden, Germany have shorter wait times than America does, and that's
not true.
Your whole basis of an argument of saying that wait times are reflective.
But these numbers are actually confirmed by the National Institute of Health. So
right, but like Love said, it's prioritized. So if I have a broken leg, whereas somebody needs a checkup, it's
yeah. So if I have a broken leg and I want to go get an appointment to a radiologist immediately, I can get it almost double, almost half the time as Canada and Norway. And if when it comes to my time, like I just use it now.
Guys,
we'll just go in order. Okay, so that was very interesting. That was a heated debate, but we'll just go in order, and then we're trying to go one by one so everyone gets a chance. So yeah, we'll give you your time like right now, but I just wanted to like interrupt you guys real quick because it was kind of getting a little bit out of hand and the timing was kind of off. So
yeah.
All right. So Love just finished speaking. So Agripona, you can do your rebuttal now, and basically you can just continue with whatever you're saying. And if anyone has to interrupt you, they can interrupt you.
That's fine. That was my main points, and there's just one more when it comes to Love also mentioned how the Declaration of Independence, we went over that. Yeah, most of my rebuttal was already mentioned with Love Dockers because it went overtime, but we'll come back later when we're going to talk about other people as well. So thank you.
I'm not, and by the Declaration of Independence and Constitution, I'm not saying that the United States has claimed responsibility for healthcare, but I'm saying that the goals of our country would align with universal healthcare based on the wording of the Constitution Declaration of Independence.
Well, that may be a valid theory, but it's not going to work well within our government because just having welfare versus having an amendment called universal healthcare coverage for everyone that will not work for us. And that's also a reason why it's actually not even in the amendment right now. So that's just all I wanted to say.
It's close. It's close. The population in the United States is 330 million. There are only 28 million uninsured. So 90% of Americans do have health insurance, and we have programs of government-based healthcare such as Medicare and Medicaid, which do provide for it. So we just need to get that last 10% insured, and that's not that unfeasible of a goal at this point. Given our
But when it also comes to like private healthcare, right? Those payments that you're paying to your private healthcare insurance, you can decide what facilities to do and what facilities to use. And this was also mentioned by Arv earlier too. The healthiest 50% of the United States population only pays for 3% of the nation's healthcare budget. And this will actually, and because that's the case, they're going to be paying extra costs for services they're not even going to be using. So with having private insurance and other situations similar to that, then they can also prioritize what needs works for them. What kind of care do they need to be provided?
Right, absolutely.
So that's
universal healthcare doesn't mean to abolish private insurance. Like the judge said, the definition of universal healthcare is to make sure that all citizens have access to healthcare. So that just means that we need to provide those who are currently insured, we need to provide them healthcare, and we could still continue having, whatever private insurance we have, we could still continue our Medicare and Medicaid programs and continue as
right. No, I agree with that. I think there's some sort of misunderstanding that a single payer system is the only way to achieve universal healthcare, which is false. We can have
there are 3 different types, but those 3 different types are actually fall under universal healthcare.
Right.
So
but
Medicare is also very expensive and it does not, like in Medicare, what we see, we as before stated, we see increases with 21%, 30%, and it's going to increase more and more if we just continue on that. If that's the case, our budget for healthcare will go even further than Canada. And do people under Medicare and Medicaid get healthcare to the same stance that we're providing money towards? The way that the government pays money may not, just because you're going to pay money towards an institution does not automatically mean that you're going to get the same type, you're going to get quality care. And that's also really important to do because our budgeting and our planning resources for our government type is different from Europe's and Canada's. We can't look at their planning and say, oh, we can do it as well. We can just reduce money for the military and this department, that department, but that's not really going to help in our situation.
Sure. Going to your point about putting money into something but not really working, Medicaid costs around 22% less than private insurance currently in America, and they have better results. Except the only problem with Medicaid and Medicare is that there are qualifications. You need to have a certain income, you need to be a certain age. If you have a disability, it needs to be listed by the government. And oftentimes people don't meet these and therefore don't receive social services. But going to your point about sort of paying for someone else, look at it from an empathetic standpoint, right? If we're trying to promote the common good of society, look at social service. Currently, you pay into it and then you eventually reap the benefits. It's a sort of same way with healthcare. I think by sort of taking that investment, and I'm not saying through a raise in taxes, because I don't think we really need a raise in taxes, but let's say even if it is through a raise in taxes, eventually this promotes not only the common good of society, but increases the number of people that are insured and therefore allows people that
become
economically active in society.
We move on.
Yeah, you can counter someone's argument later if you want to, but right now we need to move on to the next speaker. All right.
So next off we have Rishi, I believe, the affirmative speaker. So Rishi, you can begin.
All right, I'm mainly going to counter what Kaushik said because the other guys really handle each other. Specifically, he said that switching to a universal healthcare system reduces capitalism and in turn reduces innovation in new medicine, as well as that going to UHC results in less or poor service because everyone's getting the same service. Let's start off with capitalism for innovation, and I do concede that switching to universal healthcare is inevitably going to reduce the amount of innovation because prices are being regulated. At the same time, the prices for drugs right now, due to capitalism, are ludicrous, insane, and simply inhumane. Did you know that EpiPen, the patent for EpiPen was, not EpiPen, insulin, was sold for a mere $1. But now in America, it costs, at least in 2016, it costs about $450 a month. Just to put it into context, people need to buy insulin every month. It's a drug you have to take on the daily. It went from costing a single dollar to $450 a month every month for a year for however many years you live. And for people who have private insurance, that's way more affordable because your insurance covers that drug. But when you don't have insurance, that drug is simply out of your reach. Either you go into debt to get what you need to survive, or you die. Another example of pricing being ludicrous is the EpiPen used for allergy. It costs nearly $650 to $700 for 2 injectors. Something that just saves your life immediately if you come into contact with something you're allergic with, and it costs a hand and a leg. So while, yes, universal healthcare might reduce innovation, I think it's a good trade-off for making drugs priced a little bit more in everyone's price range. I also want to go on to the topic of universal healthcare reducing quality of service and reducing how much service people get. I'm going to go to my statistics I pointed out in my argument, specifically with Germany and Switzerland's systems for universal healthcare. America, I use how long it takes people to see a specialist. In Germany, about 28% of patients reported a wait time of more than 4 weeks to see a specialist, and their healthcare costs about $6,000 per person. In Switzerland, only 27.3% of patients reported a wait time of more than 4 weeks to see a specialist, and their cost for healthcare was about $7,300 per person. In America, while the rate for people to see a specialist in more than 4 weeks is 28%, the cost per person is nearly $11,000. Specifically, it's $10,586, and yet we boast the same exact rate of seeing a specialist. We have examples of UHC working in other countries and working well. For that, I feel like UHC works better in general. That's all I have to say.
Also, if I could add on something, I think we rely on sort of research, whether that be for pharmaceutical drugs or just biomedical research in general. We rely on pharmaceutical companies, and that sort of gives them leverage to not only sort of decide prices, especially when it comes to the healthcare market, but to sort of set their own prices. But I think a good way around that is to focus our money on academic institutions that are federally funded instead of relying on sort of third-party biotech companies. We can fund research labs and not only increase the rate at which scientific discoveries are being made, but also create like the same drugs that would have been created by pharmaceutical companies through academic institutions. Yeah, that's all I wanted to know.
Adding on to that, just like another pathway you could go, even if you don't fund other educational institutes, implementing UHC results in the government paying for this medicine, and in turn incentivizes the government to regulate these prices more, making it better for everyone else. That's another way you can go about it.
Okay, thank you, Rishi. Does anyone else have anything to add to that, or can we move on to the next speaker? All right, we'll just move on to the next speaker then. Kaushik, you're the third negative speaker. You can have your rebuttal now.
Yeah, so what I'm seeing from all these arguments is that there are certainly benefits to universal healthcare that do work in some nations. Like Tanush pointed out, a lot of statistics that do work where universal healthcare can work. But I feel like overall, the long-term effects of universal healthcare can really be detrimental to some nations, especially nations that have low GDPs, the ones that are developing, right? If we were to implement a system of universal healthcare in these nations, then it would really just be detrimental. It would be terrible for them because, as Arv mentioned before in his arguments, the system itself, if you want to finance a system, if you want to ensure that the system is able to continue its momentum and really be efficient as possible, we need to raise taxes on citizens and provide these financial services. And that costs a lot of budget. That's a lot of budget for the government. But if we have a nation that's still developing, such a system can be implemented. I also want to point out the fact that Tanush said commented about the United States. He said the United States, has high obesity rates, of course, like high obesity rates and some of the unhealthiest people in the world. I feel that it's not because of our current healthcare system. It's because of how it's more of the lifestyle choices. So I feel like if we focus on other government services like education and tell people like how to be better, how to focus on their health more, then I think we can fix such an issue. Because I feel like universal healthcare is not what's like I feel like the implementation of universal healthcare won't necessarily lead people to be more healthy. I feel like it does the exact opposite. Because if you think about it, universal healthcare provides access to people of all the financial statuses, right? It provides aid for all people. And wouldn't that give people less of an incentive to stay healthy? Because they know that even if they do get a sickness or they do suffer from a condition, they're always being backed up. So that kind of provides less incentive to stay healthy. Whereas if you have a system like the United States that does not have universal healthcare, then people would understand, oh, if I don't stay healthy, then I have to pay for healthcare that I can't afford. So in a way, it does kind of improve public health. If you if we do abolish do not use the universal healthcare system, we're going to improve our health as well. So I feel like on top of that, I think Rishi pointed that fact about drug prices and everything. Yes, I do understand that drug prices in America are certainly higher compared to other nations, but I feel like still we should continue using a capitalistic approach because that's what's going to help us in the future. I think we're looking at the short-term effects. We need to look at the long-term effects. Right? If you continue using this capitalist mindset, we're going to create more enhanced medicines that are definitely going to be helpful in the future. So I think that's pretty much all the arguments that I have, and that's about it.
And also to add
a couple of points to say for that. First, I'm going to start off with the implementation of U18 to developing countries. You're going to the logistics. Obviously, we're not going to go these countries don't have a healthcare system. You go in, you pay to get some sort of medicine, you come out. That's it. Obviously, you won't go from that to a universal healthcare system. We're going under the assumption that they're going to progress and then eventually develop this. You can't go from nothing to ultimate utopia, making sure everyone's healthy. That's just
right. Also, to
add
on to that, I think what we're discussing here is should universal healthcare be implemented in America, and America doesn't need to worry about having a low GDP, considering we have one of the highest GDPs in the world. Also,
Rishi, when you were talking about we're not going to have this all overnight. But the process is the journey. And if the journey is going to be expensive, detrimental to our whole government, cause a whole reform that we never cause a whole big reform that we never even looked about, that's not going to help anyone. And if you look about Japan and South Korea, who are, yes, advancing in technologies and as well as the United States, their population is much more, it's smaller than the United States. We not only have to worry about just the general population, but we also have, undocumented immigrants to worry about. And if you look at these universal healthcare reforms, none of the countries provide universal healthcare to undocumented immigrants. We have a lot of the population to worry about, while other countries are more structuralized. They can do everything more easily. They can do everything as structured. They can do everything easily because for them, it's easier to dictate a small amount of people compared to a large place as America. Even if you look at China and India, who do implement the universal healthcare regime, they're still facing a lot of struggles, especially when it comes to government-funded projects, just resource in general. People still have to pay more out-of-pocket price.
Sure, but
okay, wait. First, I'm going to start off with the undocumented immigrant part. That's a completely other thing I don't want to get into. But if they're undocumented, they're not part of America then. Objectively speaking, that's not something we worry about. We worry about our citizens. We worry about people who got here legally, and we worry about residents. Undocumented people aren't our concern ultimately. We can provide for them, but universal health care is for American people.
Also,
secondly,
I'm just going to add on. Other countries might cover 100% of the population and not cover undocumented immigrants, but America doesn't cover about a third of its population and undocumented immigrants. So, yeah, other countries are doing better than us.
Also, you say that because America is a bigger population, we would have to spend more, something along those lines. And compared to India and China, India in of itself is still developing. We have ways to go in terms of human rights and all of that. America has much longer to get where it is today. India's had much less time. You can't be comparing someone who's had 200 years to develop to where we are to a country that's had what 70, 75, around that number. I don't know the exact number. That's when we got independence, right?
I was considering about the population because we're the third largest.
Right. No. But your argument was that even
considering
with
their
a large population, they have out-of-pocket expenses. But I think their fragile healthcare system comes from or stems from a variety of societal issues, whether that be corruption or the large economic disparity, the poverty gap in such countries that sort of lead to those results, none of which America suffers. We don't suffer from a drastic a poverty rate as India or China does. We don't suffer from as much of an economic disparity. And if we're talking
China
population,
actually eradicated their poverty. Like in 2015, they eradicated their most extensive poverty rates. We still have people who live by the road without any support anywhere.
These aren't stats you can compare. You can't just say they eliminated poverty and we have yet.
Because I 100% guarantee you, without looking up any statistics, India has a higher poverty rate than America. Also, if we're talking population, Brazil has a pretty large population. They have around 220 million people. They have successfully instituted universal healthcare. The fact that they have a high poverty rate and that might affect their universal healthcare system is a totally different argument in and of itself. But their universal healthcare system works, and it works pretty well. I think I read an article written by a professor at Wake Forest University who stated that approximately 70% of Brazilians said that they like their healthcare system. Whereas if you were to take that survey in America, around maybe I believe probably like 50% would say that they like our healthcare system, considering that there are around 110 million uninsured or underinsured American people currently in America.
When it comes to the stats, actually, China, like they did a whole reform when it came to their poverty rates. They reduced it from 12% to 1.7%, and that's a lot considering their global.
Would also like to point out that China has lied about multiple different statistics, so you can't really compare that.
This was confirmed by the World Bank report in 2016.
Oh, 2016. All right.
2016, yes.
All right. I also want to point out the fact how you said it would be way more expensive to switch from what we have now to UHC. But once again, to countries with comparable GDPs to us, it won't cost that much more. Germany, it averages about $6,000 per person for healthcare. Switzerland, $7,000. America, it is currently at $10.5K per person. Switching to universal healthcare is, based off precedent set by other countries, inevitably going to reduce how much money we spend on healthcare per person.
But during the process, we'll also be spending more money to make sure those fundamental rights will also be secured. And while we're doing that in that journey, people will still have to, it's a transition, right? So like we're not going to change everyone overnight to universal healthcare. So some people will change here and there.
A transition that's ultimately worth it based off every other point. Saving lives, doing this, doing that, everything we've covered so far.
Going off of that, whether we talk about American independence, that was a transition, but was it worth it? Yeah. I think America has been so historically opposed to change that currently it's sort of crippling us. Change isn't a bad thing. Change is never a bad thing. If we didn't change from 1930s America, we would be having a lot of humanitarian crises right now currently in American society. But change will always be a process. And I think that the sort of sacrifices that we give into the transition of change will eventually allow us to have a lot of benefits. Which can be seen and reflected in the several societies of European countries that have universal healthcare and have a healthy population and a higher standard of living on a measurable scale.
Also, Tanish, you mentioned this before, you can always just reduce spending in other areas. I'm pretty sure America spends the most in military so far.
Right.
You have objectively the most powerful military in the world. It won't hurt to take a couple of bucks out of there and put it into healthcare for everyone.
Exactly. Reallocation of funds is probably the number one way to go to subsidize tax raises.
So just in summary, it ultimately leads to a reduction in cost in healthcare. It won't hurt the American population in terms of taxes, and it saves lives, and there's precedent for it. It's not like we're the first to do it. Currently, if you look at innovation, every other country in the world is benefiting off our capitalistic viewpoint. But in the end, America is the only one suffering because we're overcharging for these drugs, while every other place has universal healthcare. They're paying less. All their citizens are healthy and happy. But our citizens are suffering from enormous prices that can easily be solved by our huge budget and reallocation of our money.
Why can't we just reallocate just a capitalist market? Just have a system saying, okay, look, here's a drug price that just recently came off the market. After a few years, you can just decrease it decrementally. You can just have that instead of having skyrocket markets going up because we don't have laws on capitalist markets. That is what we need to fix. With fixing that, then all the problems regarding out-of-pocket costs, medication, treatment, at least that would be.
Exactly what we're advocating. We're advocating laws on a capitalistic market in the healthcare industry.
Just only the capitalist market.
Guys, we're gonna have to end it there.
Oh, tough. All right. Well,
I mean, if we want to encourage all.
If Kaushik, Glover, Arv have anything to say, they can say it.
We would strongly encourage you guys to speak again, especially Arv.
Yeah, I'll give him a point. So I think that America itself. What? You got it. What?
No, I'll go after you.
Okay, sure, yeah. So I think that the United States itself has various issues that it can use its budget for, right? Like foreign affairs, like healthcare is certainly an issue, but if we go to a universal healthcare system, a lot of our budget's going to go to that, and I think that leaves that kind of like, how do I say it? Okay, if we use a lot of our money for the healthcare system, right? For the universal healthcare system, that will only drown our government into more debt. I think we can use our budget to other areas as well. So I really think that so the short-term effects of universal healthcare seem very nice, but the long-term effects, I don't think so. Because if we want to continue financing this, universal system and really ensuring that it does help people, we need to spend more money. We need to spend more money to ensure that it actually does happen, and that would just drown our country more in debt. And I don't think that's where it's ultimately worth it. I think we should still stick to the capitalistic approach, and continue what we're doing right now.
Am I allowed to still speak and counter that?
Oh yeah.
Or are we allowed to talk for that, or do you just want them?
Just let Arv speak first, and then you can counter after.
Wait, no, he can go. He can go right now.
Okay. I'd like to start off. So you said a capitalistic system is best because it'll cost more, put us more into debt, and there are no long-term effects that are particularly intense.
No, the long-term effects is that it'll I feel like you guys are looking at the short-term effects. Okay, of course, it does.
I'm going to go with
money.
Long-term. Yeah, you're right. We haven't talked about long-term yet. I'm going to start off with the debt thing first. Okay, debt isn't necessarily a bad thing. Debt isn't so much where we take loans from other countries and pay it back. It's the way debts work in America is that other countries buy bonds from America because they trust in our currency and our GDP that much. We pay it back later on. As long as our GDP is rising, our debt isn't anything to worry about, even if we increase it. In terms of GDP rising, implementing a universal healthcare system is inevitably going to lead to a healthier workforce. Ensuring that everyone gets access to good healthcare means that everyone working, any work-related issues, anything, we're getting more people alive, we're getting more workers, we're inevitably increasing our GDP, which in turn pays off our debt, which lets us spend more. Universal healthcare is creating an issue and it's solving its own issue. It's increasing our debt, but in the long term, it's investing in our workforce, which in turn will increase our.
Not to mention, in the long term, we might be increasing federal spending, but we're also decreasing the net sort of health expenditures. Over the next 10 years, we're projected under universal healthcare to save $2 trillion. That $2 trillion can go to either debt or it can go to funding other social programs like affordable college and stuff like that. But that's besides the point. Universal healthcare, although might at first put us in debt, it eventually, long term.
Where do you keep putting us in debt, considering Canada continually spending $240 billion?
Right. But just to counter that, we spend twice as much. Canada spends 55% of what we do. So they're spending 264. We're spending twice as much as that. Who's in a better position?
But we also have better incomes we also have better results when it comes to diseases.
But we don't.
No, that's
for cancer, yes.
Right. but currently cancer treatments also cost 4 times as much in America than they do in Canada. So those that can afford it.
Insulin
But are you,
costs
but are you
$1
trying to
in
restrict
Canada.
quality over the quantity that it costs?
Right. You keep on coming back to this argument, but it's false because considering Canada that has universal health care, they have better quality, and that's reflected in the healthy society. Denmark, Sweden, whatever country you choose, European country or Nordic country you choose, they have a healthier population that's reflected from the universal healthcare. So their outcomes or their quality of healthcare can't be bad, because then that would be reflected in society. Whereas if you look at America currently, we're pioneers in medical research. We spend twice as much as Canada, but how's that reflected in our population? Oh, a third of Americans are uninsured or underinsured. That's how it reflects.
No, but to be fair, right? Canada has a bit easier for themselves. Their population is far more less compared to the United States. So they're like,
right,
the universal health system
and
does
their
work here.
GDP is lower in return. It's not population GDP usually are a direct relationship. If you look at India, obviously they've developed less than us, but their GDP is comparable because they have a population of over 1 billion.
Exactly.
Population isn't necessarily something to fear.
Also look at population as something to reduce prices. If you have 4 people paying for a pizza or 8 people paying for a pizza, a person would pay less in the group of 8 because there are more people paying for the pizza. Think of it as healthcare.
But what if you didn't even eat the pizza? Like, what if you're that one person who had the salad instead? You're going to split the bill.
So you're saying make sure the starving people don't eat just so you have to spend less.
No, you pay for what you need to pay, and then you also pay.
Guys, we want Arvin Love to speak because you guys are putting up like extremely good arguments, but like I feel like they have something to say as well.
I'll let Arv go first.
Yeah, go on, Arv.
That is very considerate of you, Love. So I wanted to shift away from the current arguments we're making, and I wanted to make one last one. A right to healthcare would significantly lower doctors' earnings, and I know that a lot of you do want to eventually become doctors. The Medicare system in the United States is a single-payer system where government pays for the healthcare bills. And between 1998 and 2009, it reduced physician payments in 3 different years. In 2017, the Congressional Budget Office reported that private insurance payments were on average 200% higher than payments made by Medicare for certain treatments, such as radiation therapy or MRI scans, and 89% higher for hospital admissions. In Canada and the United Kingdom, where there is a universal right to health care, physicians have incomes 15 to 51% lower than U.S. doctors. In the United States, the average physician income is $299K compared to $256K in Canada and $147K in the United Kingdom.
But did you also know that medical school in Canada costs around 1/10 of what it does in America? So they have less loans to pay back and only earn around $40,000 less on average than American doctors.
I also want to, once you're done, finish. I also want to point out.
But if the salary decreased here, the loans aren't going to change. The fees that we have to pay for med school and undergrad aren't going to change. So
the salaries won't necessarily decrease.
Yep.
I also want to point out Germany. Okay, you're giving precise examples that support your argument, but there are multiple different versions of UHC, universal healthcare coverage. Germany, the way that works is everyone's required to have a public healthcare, some sort of insurance, right? But if you're above a certain income threshold, you can then go and find yourself private insurance if you want to. There are multiple avenues for a doctor to get different types of incomes. It depends on their preference. You can serve public or you can serve private. It's your choice.
And by buying into these premiums that are much more expensive than the sort of regulatory base income that covers 100% of its population in Germany, doctors can make well above what they do currently in America. So
yeah, also we have to look at like, why are we prioritizing salary for lives saved? I mean, if doctors, I say, can make 40,000 less per year and you save 28 million more lives, and I think it's a very.
I completely agree with that. I think anybody that goes into the healthcare profession as a doctor doesn't aim to earn the most money, but rather to save lives. If they want to make money, they can become an investment banker on Wall Street. But that's not what they did. So I think by becoming a doctor, you hold a societal obligation to give back to the people and to care for the people. And currently, doctors are working for corporations rather than the common good of society. And
don't think
by implementing,
obligation should be the
You
case.
brought up a valid point about still like medical college being expensive here, but then that's going into issues that are outside of the reach of what we're debating right now.
yep. I mean,
It's a valid discussion. It is not
yeah. Educational costs are extremely high in America, and
That's another issue in of itself.
But that sort of feeds into the capitalist nature that we've always had. And while we might be pioneering in scientific research and coming up with new pharmaceutical drugs that the world has never seen before, where has that taken America other than money in like private insurers' pockets? Where has that taken America? Where has that taken people like us? Absolutely nowhere. So yeah.
At least with private insurance, you can actually negotiate prices. So then the people
guys,
who need.
Why would they do that? Why would they do that? They're
guys, we're gonna have to guys, we're gonna have to finish it off there.
Yeah.
Regarding
So
the debate.
we want to like
So
we want to give the guest speaker a few minutes to talk and maybe ask questions or share his comments on the debate. So, Dr. Kanantani Kachalam, you can speak if you want to.
So I think all the speakers had made excellent points, but we should all remember that the United States, it is the most powerful country in the world, and no country is developed if it doesn't take care of its citizens by giving proper healthcare access to everyone. This is more important, especially in this COVID times, because if you could see the outcomes in patients who are minorities, African Americans and Hispanics are much, much worse when compared to white people because of lack of access to healthcare. It is not because of anything else, it's because of disparities in health. And really, universal healthcare, it's more polarizing politically than anything else. Almost 85% of Democrats support universal healthcare, whereas only 25% of Republicans support universal healthcare. And also in Canada, yes, the wait times may be higher, but it doesn't mean that patients don't get quality care. The care that patients get in Canada is as equal and even better than the United States. Canada has some of the best cancer centers in the world: Princess Margaret Cancer Center, University of Toronto, McGill University. All those universities are amazing places for oncology. And if you have an emergency like a broken leg, someone mentioned a broken leg, they have to go to the ER. They don't need to wait for an appointment to see a specialist for 4 weeks or 6 weeks down the lane. And the doctor's salaries, we don't really care how much it's really being affected by the universal health care. And to be honest, most of the salaries are driven by RVUs, which is based on number of patients we see and not really based on what kind of insurance a patient has. It's really driven by the number of patients we see. And especially healthcare disparities play an important role in India as well. We need to realize that the per capita income in India is only $1,670 a year. However, if you think about drugs like pembrolizumab and nivolumab, for which they got the Nobel Prize in 2018, it has changed cancer care, and the cost of just one infusion in India, it's $2,600. How would a normal person be able to afford $2,600 for one infusion, which is given every 3 weeks, when the average income for the entire country is $1,600 for the whole year? How possible? If a country has to have good standards in healthcare, it is by universal healthcare, without a doubt. At least that is my strong belief. But I think everyone has raised valid points on both sides. And yes, there are challenges, but challenges are supposed to be overcome by ways. And I think single taxpayer system, it's the way going forward.
Thank you so much for sharing your thoughts on this topic. I'll now hand it over to Fahima.
Yes. Hello, everyone. So a very, very great debate by all the participants. We are really, really amazed that the youngsters of today have such a brief knowledge on universal health coverage and, talking for affirmative as well as negative. I would say both are equally difficult to stand by a point and, debate for it on your side. So I want to thank each and everyone, ranging from Tanush Swaminathan for his excellent rebuttals, and Ekapranna Ramesh being the against team, and still, working out the points right there, and Kaushik Veju for his points on time, and Love Thakur for his views on healthcare, as well as Rishi and Arav Modi. I think there's a Modi here, fighting for some universal health coverage from America. So that's a good thing. And thank you so much, because IFPWD really owes all these participants a great round of applause for making this debate one of the best in the season. So, cheers to everybody. So, yeah. And then thank you, sir. Your presence here has made this show a really interesting one. And I think you are one of the most apt judge for such a topic, and your presence really means a lot to us. Thank you so much, sir. Over to Darshan.
Thank you, Fahima. Like as you said, this was truly one of the best debates I've seen, and both sides brought up a lot of valid points. And it really was just very interesting to watch the rebuttals and counter arguments of both the affirmative speakers and the negative speakers on such a controversial topic. So with that being said, I'm just going to end off with and just say thank you to a bunch of people that helped make this debate possible. So first of all, I want to thank the founder of IFPWD, Dr. Arun Kumar. Thank you for your devotion to this organization and your hard work to set up events like this, even during these unprecedented times. We'd also like to thank Ms. Fahima, who just spoke, for helping us organize the debate, and Mr. Samachalam, who helped us make the flyers. And we'd also like to thank all of the participants and the chief guest for attending this debate, because you guys were truly the stars of this debate. And without you, it wouldn't have been as good, in if you want to say it like that. And we would also like to thank the audience for constantly providing their support and making these debates and events possible. And thank you to everyone who is still watching with us. And once again, happy Indian Independence Day.
Yep.
With that, I think we can conclude this debate.